Hey, good morning. I'm Jeannie Yandel. It's Thursday. This is Seattle Now. We're about 3 weeks into health insurance open enrollment. If you don't get insurance through your employer, you'll probably be looking to the Affordable Care Act's Health Exchange. This year, people seeking ACA plans are experiencing sticker shock and new federal rules around coverage. In a minute, Patricia Murphy will talk with one of the King County employees helping people navigate these changes. But first, let's get you caught up. Some Washington Republicans are pushing for voter ID requirements that would require proof of citizenship to register to vote. GOP leaders are holding an event today at Sammamish State Park as part of a signature-gathering effort for a voter initiative. It's proposed by State Representative Jim Walsh, who's also the chair of the state GOP. The initiative calls for people to show an enhanced ID, passport, or birth certificate in person when they first register to vote. Opponents say the initiative could deter new voters from registering and cancel the registrations of people who are eligible to vote. Initiative backers are hoping to get more than 300,000 signatures by January. Providence Swedish will lay off nearly 300 people in the coming months. The hospital system announced cuts in more than 100 departments, including frontline healthcare staff and management. The hospital cites upcoming Medicaid cuts, insurance denials, and new state taxes. The cuts take effect early next year and add up to a nearly 4% staffing reduction. Swedish is also closing its Cherry Hill pharmacy on Monday and its weight loss clinic in Issaquah next month. And the city of Seattle is suing one of the city's most prolific downtown real estate developers over a decade of unpaid bills. According to the Puget Sound Business Journal, Seattle is suing Martin Seelig Real Estate for $4.5 million. The money is owed to the Downtown Seattle Association, which helps clean and provide safety services for his properties. Just last week, 7 of Seelig's properties were auctioned off at a bargain price after he was unable to repay hundreds of thousands of dollars in loans. Check back for more headlines on tonight's episode of Seattle Now.
Health insurance open enrollment season is well underway for 2026. That means if you want to enroll in health insurance, change your plan, or renew what you already have, now is the time. If that insurance coverage happens to be under the Affordable Care Act, things might look a little expensive this year. Renewing a Biden-era tax subsidy for Obamacare was central to this year's federal shutdown. It was not renewed. On the front lines of understanding these changes are King County health insurance navigators. Daphne Pye manages and trains them at King County Health. She's here now to talk about it. Daphne, thanks so much for taking the time.
Oh, you're welcome. Glad to be talking about open enrollment.
So tell me a little bit about what you do. What is a health insurance navigator?
So I get the honor. I'm the Regional Health Services Administrator under the Affordable Care Act. So when the Affordable Care Act rolled out, every county had to have a lead organization that looked at the uninsured rate in your county, created these strategic plans to lower the uninsured rate, and also create this navigator network. And within that navigator network, anyone that wants to be a health insurance navigator in King, Snohomish, or Jefferson County, they have to come through public health. We have to train them. We have to certify them, and we have to get them set up as a health insurance navigator. And in King County, we have over 375 navigators. That represents about 35 organizations.
Let's take a step back for people who are trying to enroll or renew an Affordable Care Act plan. What are they experiencing this year?
Yeah, the sad occurrence that we are facing now are really 3 big things. And unfortunately, all 3 of those things could prevent an individual from getting enrolled or make the hard choice of saying, I'm not going to get insurance. So one of the first ones is insurance premiums have gone up. So all of our plans in King County, we have 10 plans, and that represents about 63 different health insurance options. But the premiums have increased, and on average about 22%. So that's kind of the one thing. The second thing that has occurred under the Big Beautiful Bill changes that as of October 1st, individuals who we always call dreamers or DACA, Deferred Action for Childhood Arrival, last year they were able to buy a health insurance plan and they got premium assistance. But as of October 1st, they lost their premium assistance. So they're facing an increase in premiums. And the third big thing that we are seeing is that as of January 1st, individuals who are here on a green card, so that means that they have legal documentation, they have purchase plans, but under the new federal changes, they also will lose their premium tax credit. And then, of course, the fourth thing is that we always had the advanced premium tax credits, but now those enhanced premium tax credit that really help lower those premiums will go away.
How is this showing up for people, Daphne? What are you hearing?
Yeah, so we started doing these open enrollment events back in November 1st when open enrollment first happened. And what we have seen is people are coming out. They're coming out. They want to understand what their options are, and they see these increase in premiums. A lot of people are making the hard choice to say, I can't afford that. That's too much for me. I'd have to not pay my rent. What we've been able to do, though, as in public health, we do have a small pot of money that we're able to sponsor some premiums. So we are able to help folks take a look at what their insurance options are. And those that fit the criteria where we can sponsor or pay for those premiums, we can help those individuals. But for a lot of folks, we just had one client whose premium will go up $2,000 because they are losing their premium assistance because of some of the federal changes. So there are a lot of hard choices that are having to be made now.
You just mentioned that in some cases you may be able to help people with their premiums. What other ways can health insurance navigators help people through this time right now?
One of the things we're going to do is we're going to compare plans. When open enrollment happens, our Washington Health Benefit Exchange does a really great job of auto-renewing people. So putting folks back in their plan that they currently have. But that might not be the best plan for them. So what we're going to do is we're going to sit down with that individual and we're going to look at those plan options. Is there another plan that they can choose? Now, for example, the Cascade Care plans. The Cascade Care plans were designed to give people more coverage before they have to meet their deductible. Also, if someone enrolls in a Cascade Care plan, they could be eligible for an additional premium assistance. So we're going to be able to look at, based on who's your doctor, what medication are you on, what's the best plan option, are there something that's going to be more affordable for you this year?
There are a lot of kinds of healthcare coverage listeners may be hearing mentioned right now. There's Apple Health, Medicaid, ACA. Just basically, let's clarify the difference between these programs.
So ACA is the Affordable Care Act. So that's the act that rolled out in 2010 that when the laws were changed, that ACA was developed so that we could have a marketplace to buy insurance. So every state had an option to create a marketplace where they could go shopping. So in our state, not only did we create a marketplace where you can go buy a qualified health plan, we also did the expansion into Apple Health. Apple Health is just the name of all of our Medicaid programs that we have in our state. If someone is over income for Apple Health or they don't meet the citizenship guidelines, they can buy a qualified health plan. Qualified health plans look a little different from Apple Health, right? Because Apple Health is free. You get medical, you get dental, you get vision, you get that under Apple Health. When you have to buy a qualified health plan, now we're talking about monthly premiums. We're talking about co-pays and co-insurance. So it looks a little different.
I would imagine that these conversations with your navigators are pretty emotional and difficult and nuanced right now. How are they approaching this situation? How are they talking with people who may be completely overwhelmed?
That's a really good question because some of these are facing the trauma of themselves within their own families. So they're having to take their own emotions and help clients. And the one thing that we try to do every year is we bring our navigators together and we prepare them for open enrollment. So we talk to them about what are the changes, and the impact of the changes was startling. I mean, to look at those changes was really sad because we've made so many strides to lower the uninsured rate, and they realize that the uninsured rate will probably increase because of the changes. And at the same time, what we try to do is say, it's really important that you work with that client one-on-one to give them those options. So we really try to train the navigator to understand not only the changes, but what are the options for clients, to really have them work one-on-one. We always start with, when we're working with the client, what we train our navigators is continuity of care. Where are they going to the doctor now? That's so important that we continue that. The second piece is, what are the medications that they're taking? because it's really hard to get an insurance and then you find out that that insurance doesn't cover your medication. So that's kind of the second layer. And once we can do that, we can then, in Health Plan Finder, it's a really savvy tool because it'll allow the navigator to enter that information into Health Plan Finder. And Health Plan Finder is going to come back and say, of the 10 plans you have in King County, we have 3 that now meet those options where you can keep your same provider and it covers your medication. Then that navigator can narrow down those choices. Then they can work with the client to say, let's look at your options now.
Did you say that you anticipate that people will go without insurance in 2026 because of this situation? What does that mean to you?
Oh, it's so sad. It's really sad to see, especially individuals who have established care. Maybe they have ongoing treatment plans that they're in. They need that medication to go without care. One of the things that we try to do is when that client tells us, we can see the look on their face, the sadness on their face. We can hear it in their voice. And what we try to say is, make the best choice for you. However, we want to give you some options. So if you decide that you don't want to buy insurance, let's give you a list of community health centers or public health centers where you can go and get good quality of care. Let us get you on a prescription assistance program where we can lower your cost for your prescription meds. Let's look at how we can get you a free mammogram screening so you can get your mammogram, so you can get the care that you need. How about enrolling you onto the Orca Lift program? Because we can reduce your transportation costs. The money you save on Orca Lift, you can put back in your pocket, and maybe that will help you with some of your healthcare costs. And so we really try to do that a holistic approach with the client. So if they decide they're not going to get coverage, we don't want them to walk away without some options so they can access care.
These are very hard conversations you're having.
Absolutely. They are very hard. We have these large open enrollment events. And one of the things we try to do at our large open enrollment events, we'll actually bring in health screenings. So we're going to bring in dental screenings. We'll bring in mammogram screenings. We'll bring in providers that are going to do cholesterol screenings. We do those screenings at the events, COVID vaccines, immunizations, because if the client decides, I'm just not going to get insurance, what can we do today to help you? And then what are going to be your options tomorrow if you do get sick? And we do talk to them about, hospital charity care is still there. So let's talk about hospital charity care. So let's really give you some services now. It doesn't change the fact that they don't have insurance. It's kind of a Band-Aid, right? But it's a Band-Aid to try to help them heal and help them look at what their options are and what they can do.
Is King County equipped to fill the gap here?
With navigators to help? Absolutely. I mean, our navigator partners that we have are with our community health centers. So the Neighbor Cares, the Health Points, the ICHS, the Seattle Roots. In addition, all of our hospital have hospital navigators. A lot of our community-based organizations, they have navigators. In addition, people can call us on the phone and we can enroll them on the phone. They do not have to come see us in person. And for public health, we do have 3 walk-in sites. We have a walk-in site in Skyway. We have one in Federal Way in downtown Seattle. So we try to leave lots of options for folks in King County to be able to get to a navigator.
All right, Daphne, before I let you go, let's break down the actionable steps for listeners. To have health insurance on January 1st, you have to enroll by December 15th. But as you said, there are more than 60 plans through the ACA here. So how would you advise listeners who are feeling overwhelmed by the options or nervous about the cost before December 15th?
So if they don't enroll by December 15th, they can still enroll up to January 15th. Their coverage wouldn't happen until February.
Okay.
My biggest advice for people is shop, is really take a look at what your options are. When you come to a navigator, let them know what you can afford to pay. Let them know who your provider is. What medications are you taking? Because that's going to help us look at the better options for you. And again, if you miss the December 15th cutoff, we still have to the first couple weeks of January, to January 15th. So please give us an opportunity to help us look at what your options are.
All right. And there are many options beyond just the ones we're laying out here. You can really help fill those spaces for people.
And one of the things that we also do is that there's brokers. I mean, there's a lot of insurance brokers who are part of the Health Benefit Exchange that we're allowed to refer to. And so if we can't help them, the one thing we will say is let us refer you to a broker, and maybe that broker will have a better option for you that will meet your needs.
All right. The most important thing is reaching out. Daphne, tell us how people can reach you.
They can reach us at 1-800-756-5437. Again, that's 1-800-756-5437. They could also email us at CHAP, CHAP, @kingcounty.gov.
Really appreciate it. Daphne Pye is the King County Health Access and Outreach Program Manager. Really appreciate your insight.
Thank you.
Appreciate you listening to Seattle Now, and thanks to our generous donors for your support. You can help us out by clicking the link in the show notes and following and rating the show on your podcast app. Today's episode was produced by Brooklyn Jamerson Flowers. It was edited by Caroline Chamberlain Gomez. Our production team also includes Vaughn Jones, Andy Hurst, Paige Browning, and Patricia Murphy. Greg Kramer does our theme music. Seattle Now and KUOW Public Radio are members of the NPR network. I'm Jeannie Yandel. See you soon.